we think internally a lot about the cyclical journey of consumers to patients and back again. And yes, people say, well, that's because you're Best Buy and you work in retail, so you think about consumers. And I would say, well, as a physician, I think also a lot about patients and how, while we do literally consume healthcare when we go to a hospital, it is not simply the voluntary option of going into Best Buy to, purchase a Aura ring or a blood pressure cuff because my physician recommended that I track that. So we try to think about this continuum of care and, again, how to support the person as a consumer, the person as a patient, and, again, bring in that health system, but also bring in the health plan to the equation.
New choices, new players, new models of care. Consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go. Welcome back to the leading podcast about consumer-centered healthcare. This is episode 343. I'm Jared Johnson, and here's what's going to go down today. We have the Flava of the week about CenterWell leasing clinical space and opening senior-focused primary care centers at Walmart Supercenters. What will this next chapter of retail health look like, and have we been missing the boat by not including payviders more prominently in the discussion? I'll talk about that. Then we're honored to welcome Dr. Ben Zaniello, Chief Medical Officer at Best Buy Health. Ben gives us an update about health at home from the consumer's point of view and dives into some of Best Buy's highlights in healthcare this year. Let's do this, y'all. It's time to dive right in. Are you ready? Let's go. Flava of the week. The next chapter of retail health is starting to unfold. On July 24th, CenterWell, Humana's healthcare services arm, announced plans to lease clinical space and open senior-focused primary care centers. Where? At 23 Walmart Supercenter retail stores. According to a press release, the centers will provide seniors in those communities with greater access to primary care services designed specifically for older adults. They'll be conveniently located next to Walmart stores in clinical office spaces that were formerly occupied by Walmart Health. CenterWell expects the centers to be equipped, staffed, and opened no later than the first half of 2025. According to their president, Dr. Sanjay Shetty, these nearly 24 primary care centers are specifically designed for seniors, and each location's design, including dedicated entrances and easy parking, offers patients the access that they have come to expect at our clinics across the nation. So a few observations. First, as some have argued all along, it appears that the book of retail health isn't closed just yet. It's simply starting a new chapter. On the surface, this latest evolution seems to indicate that there's still a valuable place in the healthcare value chain for in-person and in many cases transactional care with retail storefronts. Of course, we all know that this isn't the only requirement for healthy consumers or a healthy bottom line, but it's equally faulty to fully swing the pendulum the other direction and think that there's no place for it at all. Second, this potentially addresses fundamental access challenges that continue to stand in the way of true consumer-centered care. Remember, consumer-centered healthcare meets the needs and expectations for how we experience care without substantially adding to clinician burden. And that is no easy task, is it? Third, it's possible that this time around could be different simply because it's a payvider, not a retailer. The future seems bright for CenterWell, and it makes me wonder if we've been missing the boat by not including payviders more prominently in the discussion about retail health. The question will quickly become, can it scale, and does it even need to in order to succeed? And fourth, does the fact that it will come from a payvider potentially address concerns about continuity of care? To be fair, we've heard several retail leaders on this program state that those concerns are overblown in the first place, but either way, I get the feeling that there's potential for a different destination here based on who's steering the ship. And that's mostly what leads me to believe that CenterWell is positioned to rewrite this chapter with a different ending. Time will tell as always, and the economics could change at any point. But in the meantime, you know what I'm going to say. I'm cheering for every step that brings us closer to consumer-centered care, and this announcement definitely fits the bill. The book of retail health is far from closed, people. Let's imagine what retail health can look like with more payviders leading the way, and hang on for the ride. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week.
flow, the flow, the flow.
All right, everyone, let's get into the flow. Please give it up for Dr. Ben Zaniello. He's the Chief Medical Officer for Best Buy Health. Today, we're going to get an update about health at home from the consumer's point of view, and we're going to talk about where Best Buy has been seeing success lately. Ben, let's get into this. Welcome to the Healthcare Wrap.
Awesome. Thanks for having me.
What would you like our listeners to know about who you are and what you do?
Sure. I am the Chief Medical Officer of Best Buy Health. I come from a convergence of various aspects of healthcare. I was the Chief Medical Information Officer of Population Health at Providence, a big Northwest health system where I did a bunch of different things in innovation and population health. I moved to one of our startups, a company called Collective Medical that was a Kleiner Perkins-based startup before being acquired by Point Click Care, which many of your listeners may know is the largest EMR for the skilled nursing and the senior care space. I was the Chief Medical Officer there for 3 years before taking this role at Best Buy. Again, a career in personal interest all around kind of scale, innovation, a lot of it via technology in healthcare. Loving what I'm doing right now at Best Buy, and I'm looking forward to telling you about it.
Very cool. Well, it seems like we can always use some more good news in our lives. Any good news you can share with us? It can be personal or professional.
Well, at a personal level, I'm a recent participant in the patient side of our healthcare system, which is I'm an avid skier and outdoor enthusiast, which means that I occasionally meet objects that are harder than my body. So I tore my ACL in this last ski season. I am not fully rehabbed, but I am biking, running, swimming. Actually, I'm not really running. That's a lie. I take that back. If anybody saw me in my home state of Utah, they'd be like, that's not running. That's like shuffling quickly. But yes, from as a user, as a person working in the healthcare system, as a practicing physician, but now as a patient, I'm reflecting on actually that I had a pretty good experience and on the road to semi-healthiness, at least.
All right, let's start with some observations. So you've been in this role with Best Buy, if I've calculated correctly, for a little over 6 months, maybe a little longer than that. But what are some of your observations from these first few months in the role?
Yeah, I mean, the two things that come to mind first are, this is not going to be shocking to your listeners, but that scale matters. I've been incredibly excited at the scope of what Best Buy is doing, plans to do, and the scale that we can do it. So thinking about our proximity through our retail stores, but also through some of our key services that we offer specifically in healthcare, something like the Geek Squad, right? Known for installing your TV. Well, guess what? We're healthcare training our Geek Squad so they can do that work across the country, and what fantastic reach. So my first 6 months, like, I was aware Best Buy was a big company, but holy mackerel, it's a big company, and we're able to utilize that scale for healthcare. And also, a little bit philosophically, what brought me to Best Buy was the point of view that we're a technology company. We work in the home. I mentioned the Geek Squad example, but obviously a lot of the technology that people bring into their home is purchased via or directly from Best Buy. So healthcare being in the home and the opportunity there showed this conversion for Best Buy of supporting care at home, but really focusing on the technology side. I like to say that I'm the chief clinical officer of a non-clinical company, and I love it. I work for big health systems. I really want healthcare in America to work correctly, and I think the best purveyors of clinical care in the U.S., and I'm very biased here, are health systems. And I love that I'm working for a company that is trying to enable health systems to provide more and better care. Best Buy is not setting up clinics. We're not approaching healthcare from we're going to look for a certain type of patient and just take care of that patient. We're actually working with the health system so that they can take better care of their patients. And the more time I spend at Best Buy, the more I see how we can do that. And that's just incredibly exciting.
Well, I appreciate you pinpointing that partnership aspect of it, because when it comes to enabling health systems, it can be easy to feel like health systems are pitted against non-traditional players, retailers, etc. And sometimes I feel like we don't give them the chance to explain what their mission is. Yeah. Because like you said, Best Buy isn't coming in to open up clinics. At least at this point, there aren't any indicators that they want to do the work that health systems are doing. They want to enable certain parts of that work and bring it in line with consumers' expectations. And like you said, it sure feels like Best Buy has the resources to do that and accomplish that. So I'm not completely surprised that there's some success happening with Best Buy with that mission and with the scale that you're talking about. So what about health at home in general? Can you just give us a general state of the state?
Yeah, and ironically, maybe not surprisingly, health at home was perhaps one of the silver linings of the COVID pandemic. I think just personally in my own life, and I'm an infectious disease doctor, so people are going to throw things and say I have my biases, and they're totally right. I do love vaccines. I think they're awesome. And one of the silver linings out of COVID was that we learned that we could actually produce really effective vaccines even faster than we thought imaginable. We also learned that we can do care at home. I remember talking to a particular health system. I'm not going to name names, but one of their chief nursing officer, their senior nurse was talking about trying to get telehealth to work inside their health system and all their limitations, and working with their informatics people and saying, hey, can we do this? And informatics people were like, oh my gosh, this is going to take months, and here are the various issues. And then COVID hit, and it took about a week for them to set up telehealth, because again, this was one of the silver linings that in fact, hospital at home, care at home, telehealth, all these concepts that we had been flirting with for years in healthcare as at least non-inferior ways of doing healthcare in America. But now that we see, in fact, maybe better for certain conditions, that came out of the COVID pandemic. And it wasn't simply, oh, we can't see people in our four walls. We don't have the clinic visits. We're drowning in COVID patients. So that was a factor. It was also the federal government and the hospital at home waiver that emerged and created essentially funding for innovation and top cover so that health systems could experiment with hospital at home. So that's one big wave that has kind of supported care at home in general. And again, that's primarily focused on acute care at home and thinking about, okay, I want to grab their blood pressure. I want to follow their heart. I need to have a scale. I need to follow temperature. So pretty high acuity care. And certainly if you look across our customer base at Best Buy and across the market, a health system like Mass General Brigham is taking care of patients that are over 90 on anticoagulants, blood thinners at home very, very successfully. And in this case, it's not simply that this is as good as the care you would get in their four walls. It's better, because you are taking an elderly person who would otherwise be in the very foreign environment of the hospital, sleeping poorly, being interrupted by absolutely well-meaning and sometimes, quote, necessary clinical protocols and staff, is getting to recuperate from an illness in their own bed with their family caregivers while being monitored safely and successfully. So I think that's kind of one an exciting piece. But then you tie in the bigger opportunity with care at home, which is thinking of the continuity of care. And Best Buy, not just supporting with this kind of software and tech platform, the remote patient monitoring devices, but also thinking about, okay, this person doesn't need to be in the hospital. They actually just need their blood pressure monitored so we can titrate their medication, and having access to the devices and at their home, but also having access to a provider in their health system and doing that at scale. And again, if you look at some of the work we've done with Geisinger, recently a project with UC Davis and Advocate and Atrium, all of these are thinking about healthcare, not just simply in the hospital at home space, but also kind of the totality of care at home. Anyway, really exciting. You can tell I'm excited by it.
Yeah, let me put that within the context that historically hasn't been talked about from the health system point of view, in my opinion. And that's one reason why we have this show, is to consider things from the consumer's perspective. And that experience does matter. You know, there are incremental improvements to the experience that are happening, and it helps the more that we understand the fact that somebody feels safer or just more calm at home so their care can actually be improved. To that end, I feel like that's one reason why Best Buy has tended to draw my attention over the years. In fact, a couple of months ago, I saw a Q1 report that mentioned some highlights from Best Buy Health. So just from the first part of the year, let me rattle some of these off. There was the launch of Lively Mobile 2. There's the fall prevention system in partnership with Mass General Brigham. There was CAR T-cell therapy recovery, and St. Luke's as a new partner using Current Health as their platform. Did you want to add some color to any of those or mention something that wasn't even included on that list?
Well, what I love about that list is it does encompass that continuum of care I talked about before. So I'll kind of talk about most of them in turn because they are all related. We think internally a lot about the journey and very much the cyclical journey of consumers to patients and back again. And yes, people say, well, that's because you're Best Buy and you work in retail, so you think about consumers. And I would say, well, as a physician, I think also a lot about patients and how while we do literally consume healthcare when we go to a hospital, it is not simply the voluntary option of going into Best Buy to, purchase a Aura ring or a blood pressure cuff because my physician recommended that I track that. We try to think about this continuum of care and again, how to support both the consumer, the person as a consumer, the person as a patient, and again, bring in that health system, but also bring in the health plan to the equation. So Lively Mobile 2. So that's super exciting. That is our fall detection device beyond just being a fall detection device that's used by hundreds of thousands of consumers out there. It's also a way to interact with a social care center. We call our caring center. And this is a staff of professionals that when that button is either pressed or again activated on a fall automatically, instantly get in touch with the patient and begin a dialogue of, do you need medical attention? How can we support you? Or consumer is pressing help. Again, generally an elderly person. It's been purchased for them by their caregivers, often by their children, and they're able to activate it and contact our social care center and say, actually, I need to get groceries, what are the options in my area, or I need transport and meet their social needs. And importantly, as I said, that's starting as a consumer, but as we go along that continuum of care, a lot of that work is actually supported as a supplemental benefit through Elevance and many large health plans that offer it to their Medicare beneficiaries. And I think then we all go very quickly from that consumer to that health plan member, and then to actually they've fallen and they do need medical attention. So how do we slot them into the rest of that continuum of care and thinking about it from a health system perspective? So in that list that you just went, we're covering a lot of that care continuum. And as Best Buy, we're again not directly providing the care. We're often just enabling it for whether it's a health plan or a health system, but we're facilitating it to make it easier. And I think that's really exciting. I do want to add what feels like the head scratcher in that list for a lot of people, which is CAR T, chimeric antigen receptor therapy. That is one of the most exciting areas in oncology and cancer treatment today. A lot of people would recognize it as I talk about it because there's been Nobel Prize won about it, but it essentially is taking part of your immune system, taking it out, modifying it to attack your cancer and return it to you. It is fabulous. There's great data. It's saving lives. It's being done by all the large cancer institutes, Sloan Kettering and HCA Sarah Cannon and Mount Sinai, et cetera, across the country. However, the one issue with it is that your body will still and can still have an immune reaction, something called cytokine release syndrome, CRS, once you're given back these modified T cells. The issue is, of course, standard of care for years for it was that you would give this treatment to someone and then they would stay in the hospital for a couple of weeks as you watch them for badness. Totally made sense, but it did mean we were taking up really limited oncology beds for people that may or may not have this madness. And if they do, there's usually some time when their temperature is ramping up and their risk. This was a perfect use case for remote patient monitoring and care at home, because now Sloan Kettering and others are able to give people this treatment. They're able to go home and via remote patient monitoring essentially be observed just as they're in the hospital. But again, better than they're in the hospital because they get to be at home. And if anything does happen, again, their temperature begins rise. They start in grade 1, grade 2 of what this cytokine release syndrome. They then can be brought into an outpatient center for additional evaluation, additional medications, and possibly then, once treated, sent home again. So it seems like a narrow, very specific, maybe high acuity version of care at home. But for me, is a great example of how Best Buy in this tech enablement, working with health system, working with pharma companies, working with health plans, can enable more access. Because if there's a little bit of a through line for me in all of this is, I do think we provide great care in this country. I think our health systems can and want to do more. But we have an access problem. Again, not talking to your listeners. And I think if Best Buy can relieve that access problem by helping people push more care to the home, then we'll have done a great job.
Yeah, so that leads me to ask whether it's fair to say that specific use cases within specialty care are really where we can see these benefits of health at home at scale and can really start to see them multiply and hit that level where we truly understand the value. Is that fair to say?
It's a little bit the story of innovation in healthcare. Again, it's one of these things, hospital at home, care at home, it makes sense, right? Everybody would like to convalesce. Everybody would like to have their healthcare needs met at home. On the other hand, how does it manifest itself? And really importantly, and I think we have to kind of mention, the reimbursement has to lead the way, because that is both often one of the rate limiters in healthcare, which is how are we going to fiscally support this? What is the financial ROI? And so therefore you do need to be kind of specific to use case. Again, CAR T, it's weird to talk about at scale when you think we're having hundreds of people treated on our platform, and there's probably 10x that total in the country being treated every day for CAR T. That's still a small number. The big numbers, scale in healthcare, where we're really going to be cooking with gas, is going to be management of diabetes and hypertension, and thinking beyond the great work that even Dexcom has done with continuous glucose monitoring, or some of these blood pressure programs. All of these are very specific examples where we're making progress, but we do need to align these. We need to connect it back to the health systems, your primary care physician who's ultimately responsible for your care. We need to get that data back to them. We need to connect it so that it is part of that continuum of care for you as a consumer and as a patient.
Yeah, I appreciate that you've been able to connect a lot of dots here. So what else is exciting you about this work, and what else has been going on lately?
A big piece of it for me is that connecting the dots. How do we activate all parts of the care continuum so that you do see this flow of consumer data, patient data, to the provider. They're getting insights from it. They're able to intervene on it and actually change clinical outcomes, right? That's the total picture. I have a research background, so I have to think about, okay, we're doing these things. We're creating this model of care. How do we lead it back to patient outcomes that actually drive not just the financial side, right? Clinical outcomes that drive our healthcare system. So as I think about what we're doing this year, it's a lot about connecting the dots from within Best Buy. Our model is something we talk about being related to Abigail's journey. And if you go to Best Buy Health, you'll see this video that talks about a consumer that becomes a patient and goes back to being consumer, and all her touch points, and alongside her caregiver, her daughter, in that continuum of care. And so my focus and our focus within Best Buy Health is how do we actually manifest that journey, working with a Geisinger, working with Parkland in Dallas, working with Northwestern, with all these hospitals across the country that have very different needs, and figuring out internally where we can add the most value. So for example, like talked a fair bit about devices and software providers, et cetera. But one of the biggest deficits we have and issues we have in healthcare is actually end fulfillment at the home. So it would be great if you could do healthcare in kind of boxes that you mail to someone and then they unpack it and magically it works. But in fact, most of your higher acuity or elderly patients at home have trouble like putting together basic things arriving in boxes, let alone healthcare devices that then need to be connected to their Wi-Fi to transmit data. So we are doing a lot of work around that logistics piece, which is how do we support our health systems? How do we support our pharma and health plan customers so that they can get devices into the home, how they can get them activated, transmitting data back to the provider. Logistics, in fact, that what we call across the threshold fulfillment is a big part of what Best Buy has always done. I mentioned the Geek Squad and just thinking about somebody ordering a TV and ensuring that the TV gets on the wall and is connected to Wi-Fi. We're bringing that expertise into healthcare. So in rural Pennsylvania with Geisinger, for example, we're using Geek Squad to take the devices, put them on the patient, ensure that they're submitting data, and then checking up in the patient, which traditionally in healthcare would be the job of a visiting nurse service. Well, guess what? We don't have a lot of, and guess who are really great clinicians, but maybe don't want to focus on technology in their healthcare visits, and that's nurses. So the idea that we can take a technology expert and have them doing it and have the nurses be able to focus on the clinical piece of that home visit, I think is again one of these maybe incremental solves in healthcare, but I think really gets us closer to where we want to be.
I love that falls right in line with the focus of our show. And this season specifically, we're focusing on innovations that are leading consumers to live healthier lives and what it means to engage the modern health consumer. A lot of those innovations are still coming from the retail space, and I expect a brighter future from here. So what kinds of innovations do you expect we'll be talking about this time next year?
One big piece of it, and I would be remiss not to mention it, is both data, more data, better insights, and then of course kind of the AI on top of that can drive kind of greater insights and greater interventions. Again, not a surprise for your listeners. I think most health systems, healthcare providers, as a physician, have struggled a little bit with kind of the opportunity of AI. Not that we don't recognize that it's tremendously powerful, but a concern about what it could mean from a patient care perspective. And how do we ensure that we're optimizing the care for that individual in front of us, no matter what the huge body of data that the AI has derived their model off of. So I think this idea of clinical assist, again, I don't know. I know very few physicians that don't, consult Google a fair bit with their patients. I'm in infectious disease. I wish I knew all the infectious diseases out there, but I do occasionally grab Google and say, wait a second, what was this again? What tick caused this illness? What does it look like? I think AI has tremendous promise there. And what I think we'll see specifically in this area that Best Buy is working, which is care at home, is as we grab more data, we need to refine that data to create more insights. And then based on those insights, figure out what the right pathway is. Today, we have a very human-based triage system, both in the Best Buy clinical system, but also with a lot of our customers, which is with this volume of data that's coming in from the home, what are the appropriate next steps? There is no question to me that AI can ultimately be faster and better than that. And importantly, not replace the humans, but allow the human part to scale faster, be smarter, et cetera. So again, not a shocker to everyone that if you ask me where the effort is going to be, et cetera, I'm going to say we're going to get more and more data from consumer devices and some of the devices we're using in hospital at home. And then we're going to get better insights from them through these learning models, and I think even better interventions. And that's just super exciting.
Oh, let's hope that's the case. And I do see signals that it's happening. All right, one last question for you, Ben. If there was one aspect of healthcare that you could make easier just with the push of a button or the waving of a magic wand, What would that be and why?
So I still practice. I see patients on Friday. I'll give a quick shout out to the People's Health Clinic in Park City, Utah, and my affiliation with University of Utah and Intermountain that also supports our work. So 3 clinical bodies that allow me to do what I do. And I do it in a Good Samaritan state where I am allowed to see patients without malpractice insurance because I do not bill for my care. And it allows me to focus on great clinical care, optimize the time with the patient that I need. So again, not shocker, particularly to the clinicians on the call. The wand that I would wave in the American health system is to reduce the reimbursement side and the financial pressure that, again, not just practicing physicians feel as they manifest clinical care, but also the surrounding pressure, whether it is from their health system, from their health plan, from the federal government, from their families, to support their families, you name it. We have an unfortunate bind within our healthcare system towards this reimbursement piece. And the solve for that, or what I, as someone that's been working in population health for 20 years, was always like, it's going to be value-based care, right? That's how we align our incentives, where you're reimbursed for the outcomes you have in a patient, and we focus less on the time you spent with them, and we focus less on what you do to them, et cetera. We all feel that that's coming not quickly enough. It's always kind of on the horizon. Even recently, a lot of progress within Medicare and Medicare Advantage as one form of capitation of population health. There's been a little bit of a stalled momentum and reduction in fees and discord between plans and health systems. If I could wave a wand, it would to make that move faster, because I think when we align those incentives and actually supports medical providers, nurses, nurse practitioners, social workers, everyone, so that their reimbursement is more aligned with what they want to do, I think we'll see tremendous change. We've already seen a little bit as we've slowly moved to value-based care, but let's go faster.
Perfect. I love wrapping on that point. And with that, that is a wrap for this episode. It's been an absolute pleasure to speak with Dr. Ben Zaniello from Best Buy Health. Thanks so much for joining us today.
Well, awesome. Thanks for having me.